Okay, guys, good afternoon. Hi from Sanoviv Medical Institute in beautiful Rosarito Beach down here in Mexico, not far away from the U.S. border. Today we're going to talk about a little bit about gluten, and my name is, in this case, Oscar Puig. A little bit of my bio. I'm a graduate from University in Mexico, which is, the name is Universidad Iberoamericana, or Ibero-American University, with a degree in nutrition and food science. Luckily, I came into a good job here at Sanoviv, and actually working here is almost like a continuous education program. IFM, metabolic typing, metametric lab, functional evaluation, core concepts of what is nutritional medicine, functional endocrinology, and also a little bit of nutritional medicine with diabetes, metabolic syndrome, cancer, and autoimmune disease courses. So what are we going to talk about? We're going to talk about what's gluten, also what's the big fuss of everybody removing gluten from their diets and all these gluten-free products in the market, and how do we know if we're actually gluten sensitive, that's actually the most important question. So what is gluten exactly? Gluten is actually referred to the protein that you find in wheat, specifically in the endosperm part of the seed, as you see the little diagram right there. This actually nourishes the plant embryos during germination and actually later affects the elasticity of the product. That's why when you do or you bake bread, in this case, you can actually have that mushy type of extension part of the bread, because that's the gluten part of the seed, or in this case, the milled grain. Now, gluten is actually composed of two different types of proteins, gliadin and gluten. And most types of this case of gliadin are actually three subtypes, which are alpha and beta and gamma and omega gliadin, which the main one that really triggers an immune response is alpha gliadin. And we'll see it a little bit more in front. So what happened to wheat, and why is gluten such a big fuss today? Now, we know that wheat is overproduced in the U.S. In 2012, they actually produced 61.8 million metric tons of wheat. We know that it's hybridized, crossbred, and introgressed to make the plant resistant to environmental conditions. This naturally increases the yield per acre of the product. And it's actually used in a lot of products, as you see in boxed cereals, baking mixes, baked goods, meat, soups, desserts, processed teas, pasta. Also, it's mixed beverages, vodka, gin, ale, whiskey, beer, commercial salad dressings, chewing gum, and white sauces also. So anything that is actually used with the sauce that is actually thick, it does contain wheat. So you have to be careful if, in this case, you're following a gluten-free diet. Now, the evolution of wheat is that the first grain, the grain we're going to call the grandparent grain, is actually not the same grain that even your grandparents consumed or us consume today. It's actually changed very dramatically in the last 50 years. Now, it changed because we have more human beings in this planet, right? So sometimes some populations tend to go into areas where they don't have enough food. So we have to produce more products so we can be able to feed certain areas. So one of the main reasons why they actually hybridize the seed is to actually produce more, like I said, more wheat, the more food that we have, right? But now all of these changes in the seed are actually meant for helping the seed to fight through conditions of drought or pathogens or fungi that actually is produced with the growing of the seed. Now, in the States, it occupies 60 million acres in the U.S. just to produce what is wheat. Now, the father or grandfather of evolution of wheat is Dr. Norman Borlaug, which actually is credited with saving hundreds of millions of lives, especially because he crossbred this type of seed to actually yield a little bit more wheat. He actually said, if the world population continues to increase at the same rate, we will destroy the species. And yes, we will probably cause that if we have a shortage of food, but at what cost, guys? That's the big question. What is the big cost of manipulating food and obviously our food lines? Now, we're continuing a little bit of explanation of the difference of wheat. And the first wheat that we can find is acorn wheat, which is actually very simple, a simple genetic code, which is only 14 chromosomes, which is very popular in Europe. Now, example, 14 chromosomes, and then we have wheat today, which has about 48 chromosomes, which is actually very different to the 14 chromosomes. Another example is that this hybridization actually increased the protein counts, or the gluten protein, in this case, in the wheat. It actually contains 14 more gluten proteins. So the bigger or the more proteins that stay in your small intestine, the more probable or probability that you would have a immune reaction against it. Now, another thing that you do have to have in mind is that wheat was actually introduced 10,000 years ago. So roughly it's about maybe 300 generations in our bloodstream. So only 300 generations, which is a surprising data that I think haven't had enough time to be exposed to the wheat and to be adapted to the wheat, right? And we are actually rapidly changing the protein, which is now not making us adapt to what is the protein of it. Now, the first register of this was in Egyptian times, where they introduced wheat. And the funniest thing is also that the first real register of diabetes was at the same time, with having the symptoms of frequent urination or polyuria in a patient. So polyuria is normally registered for diabetes, not one of the symptoms of diabetes. It can be symptoms for other things, but in this case, it can be one of the symptoms for diabetes. Now, a quick tip for you guys: where can we find gluten? Barley, rye, triticale, wheat, bulgur, durum, farina, gram, kamut, semolina, and spelt. So if you guys are trying to follow a gluten-free diet, you have to completely avoid these grains that I just mentioned. Okay, well, very quick tip for you guys. Now, we have that picture of wheat, a very good slice of bread being handled by a guy that probably is handling pretty bad chemicals to wear a suit like that, right? Now, to break up the idea that wheat is genetically modified, it's not genetically modified, it's hybridized, and it's actually managed to a way that we actually are crossbreeding the seeds, different type of seeds, to make it more resistant than anything else. Okay, so it's not really genetically modified, more crossbred than anything else. So what's the big fuss? We talked about the crossbreeding making it a little bit more difficult to digest because the amount of proteins that we find now in wheat. So the big fuss of it is that wheat by itself produces toxins that actually damage the lining of the gut. It also produces toxins that bind to essential minerals, making them unavailable to the body. And also basically produces toxins that inhibit digestion and absorption of other essential nutrients, including protein. Okay, so a toxin, for you to have an idea, is something capable of causing disease or damage to tissues when it's actually entering the body. Now, remember that seeds, example like the wheat seed, or also like the rice seed, or like also nuts, or any seed like the pumpkin seed, is a seed that is going to give life to another plant. Now, it doesn't move, it doesn't run away, so it has to find a natural way to actually be competing against predators. So it creates this natural chemical or mechanism of defense that when an animal consumes it, feels pretty bad and says, okay, I'm not going to eat that again. But for us, it's not the same way. So what we need to do is that if in this case, a quick tip for you guys again, if you're going to consume nuts or seeds or any other grain that can be gluten-free, you do need to soak it before you actually use it. So you soak it at least 6 to 8 hours before you use it, and you can actually help to just eliminate these natural toxins that you find. Now, what's the big trigger? We're talking about proteins and natural toxins, but what is the white elephant in the room? Our digestive tract. We don't really pay attention to it, and we actually have to center the whole treatment around our digestive tract, which is actually very important because 90% of all your nutrients are actually assimilated in that area. To give you a perspective of what actually wheat does, and specifically to the sonulin binding protein, and that actually helps to open those tight little junctions that we have right there, right? So you see on the left-hand side the normal tight junctions, then you see on the right-hand side leaky and inflamed guts. Now, opening those tight junctions. Imagine like if it was the laces of your shoe. Sonulin, what it does, it controls the opening and the closing, okay? But what you tend to do is that it binds to gliadin, and gliadin disrupts the function of the tight junctions and opens these walls, making it a very problematic situation to your immune system, because you have bigger particles going into the bloodstream, and your immune system is trying to attack. So it can attack also normal proteins coming in from food, so it causes autoimmunity against these type of things. Now, you have the example of somebody that actually has a food allergy panel, and it comes out with probably 80 allergy to any other type of foods, and it's because of leaky guts. Okay, so in genetically susceptible individuals that really pose a DQ gene, an excessive amount of sonulin is actually released upon ingestion of gliadin, which is obviously the protein found in wheat. This excess sonulin does really open the tight junctions, like I explained, between the GI epithelial cell and allowing large macromolecules to leak through the GI epithelial layer, and it allows larger partially digested food particles, proteins and peptide fragments, as well as enteric microorganisms, gram-negative rods, to actually leak into the bloodstream. Now, what's going to happen? You're going to cause an inflammatory response, meaning that your GI tract is going to create antibodies to pick up all these things in your blood. Okay, so if you, in this case, have a food allergy test and it comes out with more than, let's say, 40, I would be careful of that. It would be more treating your leaky guts other than your food allergies. Now, what are symptoms of leaky guts? It's a pretty long list, right, guys? From abdominal pain to poor immunity to malnutrition to diarrhea to poor memory to chronic fatigue, abdominal spasms, anal irritation, depleted appetite, sluggishness, anxiety, also muscle cramps, muscle pain, myofascial pain, mood swings also. So if you guys have any of those symptoms apart from bloating, gas, and constipation, you want to treat your guts. Now, leaky gut can really be a root cause of many chronic conditions, because what happens when you open those tight junctions is that you create a thing called molecular mimicry. Now, what it actually has is a kind of like a cross-reaction type of situation with your own tissues, and it's actually an unpredictable manner of producing autoimmune disease such as celiac disease or rheumatoid arthritis or type 1 diabetes or multiple sclerosis or Hashimoto's or Graves' disease, or in this case any polymyositis or anything like that. Now, an example of this is that in Graves' disease, with antibodies to the enteric gram-negative organism, Yersinia actually has been found to cross-react with TSH receptors, meaning that it will cause hyperthyroidism by stimulating the TSH receptors into your thyroid gland. So it's not really that you're actually having issues with thyroid. Probably it's just a bug that you have there than your gut that's actually letting it in too much. The same thing with rheumatoid arthritis actually has been linked to molecular mimicry with Proteus bacteria, which is in this case obviously an issue specifically that you need to address just with your medical doctor, if in this case that is the case. Now, another interesting fact is that wheat is actually a carbohydrate that's actually packed with a very strong punch, meaning in this case that it contains 70% carbohydrates, 10 to 15% fiber, and 10 to 15 protein in comparison to emmer wheat, which emmer wheat would be kind of like the second generation to acorn wheat, which contains 28% more protein. Now, what's the big difference here? What's the big punch? Amylopectin A. 75% of that 70% carbohydrate is amylopectin A, which is actually rapidly converted into glucose and absorbed into your bloodstream. Not the same found in legumes, or not the same found in some vegetables, and in this case fruits and root vegetables, example like bananas and potatoes, which kind of resist the digestion, not really help you to raise up your blood sugar levels. But that 70% is actually 75% amylopectin A, which actually really goes highly into your bloodstream and causes this insulin spike. So The question would be, can it actually be a link to what we actually are going today? We see obesity as one of the main epidemics, but that is just one of the results of many other conditions that can be occurring, like diabetes, cardiovascular disease, osteoporosis, things like that can be linked also to this. Now, we know that in the U.S., starting from 1980 to 2010, we see the rising effect of diabetes. And the question would be, can it actually be related to wheat? Dr. Davis really spoke extensively of wheat, basically about millepectin causing hyperglycemia and insulin resistance, specifically diabetes which is reaching a very high epidemic situation, not only in the U.S., but in other countries also surrounding the U.S., example like Mexico. I don't know about Canada, but I would think also in Canada. Thing is that these wheat proteins do also actually stimulate appetite. So it's not only that it contains some millepectin A, but some of the proteins also cause addiction. So it's a kind of a vicious cycle that the person has. Now, we're going to talk a little bit more about wheat, specifically about example of the millepectin A, the germ lectin part of it also, which is also intestinal toxin, and we'll talk about that in a moment. But now, wheat and the obesity connection. Now, we see that it actually is a very high glycemic, very high trigger to introduce insulin or high insulin into your system. So we see that the average BMI in the 19th century was 23.2, right? This was actually done on soldiers in the 19th century. And then the average BMI, again, in 1990 is now in the range of overweight. Now, 1980s, the whole grain products were actually introduced because they were seeing this change on overall weight, on percentage of body fat mass, right? And this actually introduced the replacement of what is flour products, which are actually very related with, or white flour products are related with heart disease, obviously colon cancer, and diabetes. And naturally, they saw a reduction in all these conditions once they actually introduced whole grain products. Now, we know that two-thirds of Americans are actually overweight or obese, and the USDA says that they're actually in this way because they're inactive and glutinous. Now, yes, we're inactive now in this case. We do have a little bit of lack of stimulation to do physical activity now, but what's the glutinous part? Is it actually triggered by food also? We know in the 1950s to 60s that we had 9.7% obese in the U.S. We jumped all the way to 2050, and it's projected that 42% of the population is going to be obese. Okay, that's a staggering data compared to what we had in the 1950s. Now, can it be related, again, to what we know as lack of physical activity, or in reality, all the chemicals that we naturally find in food, specifically in wheat, and now also other chemicals that we find in food that are not supposed to be there. Now, you can see the impact of change. Before 2005, the food guide pyramid from the USDA recommended to consume at least 8 to 10 portions of grains in this case. Now, after 2005, epidemic of obesity and diabetes made them change to consume 7 ounces of grain, which is actually 1 regular slice of bread. So about maybe a consumption of 3 to 3.5 slices of bread a day, in this case. Before 2005, those 8 to 11 servings of bread could include cereal, rice, or pasta, equals to 16 ounces, in this case, 16 to 22 ounces per day. That would be equal to 9 to 11 slices of bread a day, right? Now, we know that common bread today is not only just wheat flour, it's also cornstarch, high fructose corn syrup, sucrose, and also some food colorings, and all these things can actually alter that function of managing your blood glucose levels. Now, to understand this, the spike of blood glucose and the insulin spike that your body produces, specifically hypoglycemia, wheat produces elevated blood sugar level more than virtually any other carbohydrate that you can actually find, even compared to beans and even compared to candy bars. Extreme blood sugar and insulin are actually responsible for growth of fat, specifically around your visceral organs. Now, that visceral fat is different compared to what is the subcutaneous fat. Now, it's actually capable of triggering a universe of inflammatory phenomena, abnormal cytokines, or cell-to-cell hormone signaling, like in this case molecules such as leptin, which is a hormone that we're going to talk about in a moment, resistance, also a tumor necrosis factor now, also white blood cells that empty out onto the liver, and then the liver responds again with a abnormality what is a consequential inflammatory reaction. Now, all that fat that you form, that is basically visceral fat, is actually capable of producing a certain cytokine that can actually protect you. But naturally, the more fat that you have, the less production of that cytokine. Now, visceral fat is also related with rheumatoid arthritis and also colon cancer. Now, the way that you want to measure if, in this case, you have visceral fat, or you're asking yourself if you have enough visceral fat, is the waist circumference, which is actually a very powerful predictor of these conditions, and also as well as mortality. Now, we talk about GI glycemic index of foods, right? Example, wheat bread has about 72, a GI of 72 compared to table sugar. Now, 1 spoon of table sugar has a GI of 59, okay? So you have to be careful if, in this case, you're also gluten-free and you're listening to this webinar and you're gluten-free. Products found in gluten-free products like cornstarch, rice starch, potato starch, and tapioca starch, also with the same GI almost compared to wheat. So even though that you're actually doing a good move on going gluten-free, still you're not solving that blood sugar problem. If in this case you have that extra visceral fat that you don't want. Now, what's the problem with visceral fat? Now, once you create visceral fat, you create adipose, little molecules right there that are basically fat. And these little fats are not only just fat, they're a vital organ onto our system. They produce leptin, they produce estrogen, they produce resistin, adenopectin also, insulin growth factor 1, tumor necrosis alpha. All those little molecules are produced by fat. Now, we need fat. A normal percentage of body fat is ideal for somebody because it not only helps us to give warmth to our organs, but it also gives structure to our organs, keeps them where it's supposed to be, but also manages to produce all these little hormones, right? Now, excess visceral fat is really considered to be a very high-risk marker for breast cancer. Now, and obviously, the bigger the belly, the more estrogen that you're going to produce. So it actually stimulates growth of breast tissue, specifically in men. So that's what we call gynecomastia, just what they call in this case larger breasts in men. Okay, so we want to be careful with that. And a quick tip for you guys is that how do we remove visceral fat? Number one, you guys reduce or eliminate processed food intake. Key secret right there, guys, more than 5 ingredients you do not touch. And those 5 ingredients have to be readable in the label. Now, you do have to eliminate wheat consumption and also gluten-containing grains to help you to just manage this this production, right, of insulin curve. Now, reduce and eliminate alcohol intake also, and regularly have certain activity about 30 to 60 minutes a day to just help you control weight. Now, there's actually a study out of Duke University where a lot of people just went on to trying to reduce their visceral fat. Those that actually jogged about 12 miles, jogged or walked, didn't really reduce their visceral fat, but really had an impact on not gaining more visceral fat. Obviously, those that had a longer period of time of exercise, more than, let's say, 20 miles, they actually did lose not only visceral fat, but also subcutaneous fat. So that's how important physical activity is, guys. Not only diet, but also physical activity. So you guys have to get mobile to actually help your body. Now, the most powerful thing is that you guys have friends or family members or yourself that says, I'm addicted to bread. I cannot skip with having a slice of bread into my meals. Now, William David, MD, which is actually the author of Wheat Belly, has this really good statement. We can actually dictate food choice, calorie consumption, timing of meals, and snacks. It can actually influence behavior and mood also. And it can even come to dominate thoughts. Now, you tend to have withdrawal symptoms of eliminating wheat from your diet, even grains. You have extreme fatigue, mental fog, irritability, inability to function, also work in school, depression. In the first kind of week, it kind of sounds like when people are going off of alcohol or even also drugs, you know. And the reason for that is that it can actually affect the central nervous system as much as nicotine or crack cocaine. Okay? Actually, the first study done that revealed this type of issue was actually done in the Second World War, specifically with schizophrenic patients. Obviously, since it was a reduced amount of food, they actually reduced all their symptoms. They reduced hallucinations, delusions. They had less attachment of reality. It also actually increased all those symptoms when wheat was actually reintroduced. Now, there was also a very good impact on patients with autism and ADHD, where if you remove, obviously, wheat, they actually have a better behavior overall. Now, we know that's an appetite stimulant, right? Because the insulin curve that we have, naturally, if you consume wheat, that adenopectin A is going to cause the insulin spike, and then once it comes down, your cortisol is going to message the liver alongside with another hormone to start secreting more glucose, and then you get another appetite, and then you consume more, right? But now we know that it affects also the central nervous system. It's not only what is, in this case, the carbohydrate part of it, it's also the chemical part that you find in wheat. Now, wheat is actually, to understand this, we're going to talk about the blood-brain barrier. Now, wheat is actually exposed to pepsin and hydrochloric acid, and that's actually degraded to polypeptides. And that these polypeptides are actually penetrating the blood-brain barrier, as you see the little diagram on the side. Now, it can actually provoke the amygdala, the hippocampus, the cerebral cortex, and other brain structures. So once it's in the brain, it binds to brain morphine receptors. We call them gluteomorphine. They're opiate receptors, guys. It's that strong. It can actually affect you that way. So naturally, when you come down from that wheat high, you tend to actually get that craving again, and then you have to eat wheat again. So not only the sugar problem is one of the main issues, but also this, what we call gluteomorphine. Now, studies show that if you remove wheat from your diet, it's proven that you're going to reduce 33% of total calorie intake. So automatically, you have an impact with just removing wheat from your diet. Now, what's another big thing with in this case, gluteomorphine or wheat? Gluteomorphine found in wheat is that wheat nearly stands alone as a food with a potent central nervous system effect. So if you guys have depression, if you guys have, I don't know, any type of condition in this case that would be leading up to just any panic attacks or anything like that, I would really recommend that you remove wheat from your diet. Now, celiac disease is a very common thing that's not only related with wheat in this case, and they always recommend if you're celiac, just remove wheat from your diet. Now, what's the difference between us, a normal person, and a celiac person, right? Now, we have, on your left-hand side, we have a normal, healthy villi, and we see all the nutrients actually being absorbed into our bloodstream, right? Now, we have the damaged villi on your right side, which we can actually classify from Marsh 1, Marsh 2, and Marsh 3, the level of degradation of this villi. Now, you see all these nutrients not being absorbed, and then you see some nutrients being absorbed. Now, celiac disease, one of the main problems is malnutrition, which then leads off to osteoporosis and only leads off to other things, right? But now, does this only occur in what is celiac disease? Or can it actually be a silent celiac disease also? And we'll see that in a moment. Now, the connection between celiac disease and wheat consumption was actually first made in 1953. And it was actually made by pediatricians. The most dramatic evidence was actually the failed adaptation to wheat in obviously a celiac disease. Also, almost all celiac diseases are lactose intolerance. So you want to have that in mind, which actually disrupts obviously the small intestine, the function of the small intestine. So, guys, not because you don't have celiac disease at 25 doesn't really mean that you're not going to have it at 45. It takes 7 years to actually build up to actually have this damage in the villi. So it takes 7 years, guys, 7 years. There was a study in Alberta, Canada, that obviously a lot of kids were actually diagnosed with celiac disease, but in this case, 53% of them had no symptoms. So it can be also called a silent celiac disease. Now, we're only seeing the tip of the iceberg, right? 12.5% of patients diagnosed with celiac disease. And those that are 87.5%, which are not diagnosed, but we can actually call it silent celiac disease, right? Now, celiac disease is characterized by antibodies to two components of gluten compound, alpha-gliadin and transglutamase. I'll explain them a little bit later on. But we know that people can actually react to several other components of wheat and gluten. As you see in the diagram, it's not only gliadin, but you have glutenin, and then you have glutamorphins, and then you have the lectin parts of it, and we'll explain that in a moment. No, but all these components can actually react the same way to celiac patients. Now, what are the symptoms for celiac disease? Cramping, diarrhea, weight loss, anemia, migraine, aches, irritable bowel syndrome, arthritis, neurological symptoms, infertility, short stature, depression, chronic fatigue, or acid reflux also. What are the conditions associated with celiac disease? Dermatitis, a little bit of spots in your elbows, knees, and back. Liver disease, example like biliary cirrhosis or tubular cancer also. Autoimmune disease like rheumatoid arthritis, Hashimoto's, lupus, asthma, irritable bowel disease, ulcerative colitis and Crohn's, diabetes type 1. No, diabetes type 1, patients with diabetes type 1 have 20 or more fold greater risk to actually developing what is in this case celiac disease. Okay. We also see obviously insulin-dependent diabetics, like I said right now, neurological impairment, and also nutritional deficiencies, specifically iron deficiency that leads off to almost a 69% probability of anemia, B12 deficiency, folic acid, zinc, A, D, E, and K also deficiency. Now, not only we're seeing what is in this case a sugar response, also the central nervous system response, and also the gut relation with it, but also can affect our heart condition. Now, we have 3 finite results, which is actually a term that Dr. Mark Houston came up with, which are a response to the aggression to our gut. Our immune disease tries to protect us as much as possible, but it produces inflammation, oxidative stress, and also vascular autoimmunity dysfunction. Now, to understand this is that when you consume gluten, this gluten obviously binds onto SON1 receptors, which is obviously the offender. And then you create this cascade of inflammation, oxidative stress, and autoimmune disease. That cascade means that you're going to produce these myeloperoxides, cytokines, tumor necrosis factor alpha, also, and interleukins. Now, once you produce these chemicals, our body is trying to produce fat molecules to actually protect them and encapsulate them, right? But once you do that, it causes oxidation, it causes glycation, it causes inflammation. Yes, the process triggered by carbohydrates, especially those actually are made from wheat, cause a dysfunction in what is in this case HDL, which is your high density lipoprotein, via the myeloperoxidase, which then damages the endothelial cell. So not only is causing what is high sugar levels, causing also irritation to your brain, it's causing irritation to your gut, but it's also causing irritation to your cardiovascular function. Now, quick tip, where else do we find gluten? Glucose syrup, rice syrup, dextrin, malts, flavor enhancers, flavor and extracts also, caramel color, modified food starch, starches that are not identified in the product, binder, fillers, excipients, extenders also, FOO also, MSG, in this case also hydrolyzed vegetable protein, hydrolyzed plant protein, textured plant protein, and textured vegetable protein also. Now, all of these are not wheat, but they can derive from other grains that also contain gluten, so you can actually be affected by it. Now, we're going to have a small recap. Now, we know that wheat is not the same as our ancestors consumed. It actually continually contains various chemicals that are toxins to our body, It weakens the gut function via soluble gliadin function, creating leaky gut. It's high glycemic, and it has a direct relation with the obesity diabetic epidemic, and it's also addicting, guys. Now, if I don't have any symptoms, should I test myself? Now, it's clinically proven, like I said, to be a 7-year-long process of production of antibodies before you damage gut tissue. 7 years before you really have anything going on in your system. So I would say yes, specifically because you may not have any symptoms, but your damage is silent and present, guys. So even though that you don't feel it, you can still be producing that damage. Now, the traditional celiac testing, which is measuring for anti-gliadins, or alpha-gliadin in this case, and also transglutamase antibodies, endothelin antibodies, HCl, DQ, and DQ8, also markers, which are genetic markers. Rectal challenge, which was something used in the past that introduced a portion of wheat into your colon and they would see if it would cause inflammation. And actually, the gold standard one would be the small intestine biopsy, right? But that's kind of like the last stage, because if you already are present with damage on the small intestine, you're already obviously having a MARS 1, MARS 2, MARS 3 type of lesion. Now, like I said, it's not only alpha-gliadin. You have to actually test omega-gliadin and gluten and glutamorphine and pyrinorphin, also, and anti-glutenins and things like that. You also have to check, obviously, in this case, the genetic markers specifically. The genetic markers really just kind of bind to gluten peptides. So in 20 to 50% of the times, if you just measure alpha-gliadin, you come out obviously with a negative. If you do transglutamase, about 86 to 89% can be positive. Endomycin, about 90% would be positive. But yet again, if you do the small intestine biopsy and you come out negative onto it, and yet again you have transglutamase positive, they're not going to recommend a gluten-free diet. So if it does come out like that, what to do? I would recommend that you do array 3 and array 4 from Cyrix Labs. Dr. Vojani, in all his wisdom, actually developed these tests, array 3 and array 4, which are actually very, very important now, very important tool for our diagnostic part of our programs. Now, Cyrix Test 3 actually breaks up all these different type of not only what are lectins, what are also the opiate type of things that we talked about, and all the different type of gliadins that we talked about, and transglutamase enzyme factors also that we talk about. Now, the glutamorphin and dinophren, are the opiate peptides, now, which can actually lead you to brain fog or panic attacks and depression. The glutenins are just lectins that you find in this carbohydrate binding protein thing that it contains, which actually produces antigens, and they become toxic and they cause inflammation and they produce autoimmunity also. Transglutamases are just a family of enzymes that are formed from protein polymers, which is important for formation of what it is, in this case, are barriers and stable structures in your body. We have them in many other tissues, example like bone tissue and brain, and also in skin, right? So you have TG2, TG3, TG6, okay? Now, TG2 can actually be related more onto what is, in this case, damage at a gastrointestinal level. Now, TG3 is more onto what is skin issues, and TG6 now is specifically to neurological diseases, okay, or disorders primarily. So it's actually damaging your neural tissue, guys. So it would be actually very important if in this case you have any of the symptoms that we comment in the past, if in this case you do, to do this test. If in this case you're coming to Sanoviv, also consider doing this test, because actually it is very important information. Now, let's say you guys go on a gluten-free diet and you still have all those symptoms, and you ask yourself, why do I still have all these symptoms if I'm going gluten-free now? To your knowledge is that all these foods that you see on your screen can also mimic gluten in your system. Okay? There's a cross-reaction with gliadin, specifically with cow milk and the proteins found in cow milk, specifically also with yeast and coffee. Now, those can mimic gluten in your system. Quinoa, tapioca, rice, eggs, and things like that, and soy are, well, first off, quinoa, tapioca, and rice and potato are the most common gluten-free products that you can find, and they're overconsumed sometimes. And egg and soy are just common food allergens, right? So that would be one of the things that, if in this case you are already gluten-free and you're following the diet 100%, you want to just kind of test yourself if in this case you have these cross-reactive situations. Sorry. So to understand this array 4, right? You have the gliadin antibody, and then you have gliadin antigen going and docking onto this gliadin antibody. Now, let's say you consume casein or rice, right? Or casein, basically protein that you find in milk. Even though it's not the same structure, it's going to bind again onto gliadin, and it's going to bind again onto gliadin with rice, and then you just get all these reactions. And even though that you're consuming a gluten-free diet, which basically is rice, and you're still consuming milk on a gluten-free diet, you can still get the same reaction. Now, it's important to know that you can still trigger obviously the autoimmune response with the gluten-free diets. And it's important for you to know that it takes up to 1 year to remove antibodies to gluten from your system. So, let's say, guys, you're telling me that you're following 99% of gluten-free diet. There's no such thing, guys. You have to be a year on 100% gluten-free diets. I would really recommend that you test yourself first with array 3 and 4 before, in this case, anything is going on with in this case, involving changes in habits, going for just introducing new foods into your diet, all these things. Now, I do really recommend it. So now, what do we know by now? We know that wheat and gluten is associated with obesity, type 2 diabetes, cardiovascular disease, and various autoimmune diseases. We know that normal testing is not properly done. Array 3 and array 4 would be something that you do want to consider. Gluten-free foods can cause the same reaction as gluten-containing grains, with, in this case, array 4 in the cross-reactive situation. And they can also be associated with high glycemic reaction. Then we have to be up to a gluten-free diet up to a year to have really a significant change. Now, so what do we do now? My first recommendation would be to test yourself. It's important to know how your body's reacting. So array 3 and array 4 would be something that you do want to do. The second second thing to do, would be clean up the guts. Remove all common offenders. Wheat, soy, dairy, corn. Also gluten-containing grains, guys. So just remove any of the common offenders if, in this case, you have any gut situation. Now, introduce functional foods. Functional foods mean foods that are going to actually provide something beneficial for you. So, example, fermented foods, sprouted foods, prebiotic foods. Now, you guys can actually go into our website, sanovistore.com, and there's a book that we recommend. It's called Wild Fermentation, and it actually explains to you how to ferment from vegetables, how to do pickled things like that. It's actually a very interesting book, and it's actually a very good nutritional tool book to have on to what you have on your house. Now, also introduce nutrients that will actually aid in repairing the gut. We have various supplements that you can actually recommend that we can recommend to repair the gut. You can go directly onto sanovistore.com, and we have various products that you can actually purchase directly from our store. So you can actually aid in just repairing your gut. And last and not least, obviously, stay committed. Guys, we said about 1 year to actually follow a gluten-free diet and have a really big impact on you. Now, if you guys want more information, you can actually go ahead and purchase Wheat Belly or Grain Brain or the Gluten-Free Gourmet if you're already gluten-free and are actually struggling with recipes. I also really encourage you to go on to the Gluten Summit, guys, which is a powerful, but very powerful summit with very important speakers. Example like Michael Marsh, which is kind of like the grandfather of celiac disease. That's where we come with the term Marsh 1, Marsh 2, Marsh 3, the level of damage onto your small intestine. We have Mark Houston, Alessio Fasano, Aristo Vojani, which obviously is the the maker of Array 3 and Array 4, Meyer Kyman, Tom Altier, which is the author to Whole Life Nutrition Cookbook, Lauren Cordain, which is the author of Paleo Diet also, which is actually a very important book, Tom O'Brien, which is almost the godfather of gluten, and Liz Lipsky also. Very, very powerful summit. I would really recommend that you guys can go. Now, how can Sanoviv help you? Now, if you guys come down to Sanoviv, our diet's a very specific diet. Now, you come into our diet and there's no common offenders like we talked about. There's no gluten, no dairy, no wheat, no soy, no corn. There's actually no grains. It's just basically raw vegetables, some good clean animal protein, and minimal amount of fruits. And then we don't use any other things, in this case, like sweeteners or anything like that. So it's actually a very clean diet. Well, we actually call it a hypologenic diet. So now you come here and you go through our diet, our program, and just by going through the diet, you're already doing about 70% of the whole job. Now, you have a medical consult and you have a nutritional consult, and then we'll work as a team to actually look at what are the probable deficiencies, the probable nutritional needs that you would need as a patient, and we'll obviously start to give you a protocol to follow. Now, the whole experience is not only nutritional and medical, but you still also have other areas, like in this case, the psychological area, the spa area, our pools, our whole building is actually a building that's actually dedicated to detox. So you guys also benefit from detoxing while you're here. So I do encourage you guys to go to www.sanoviv.com and inform yourself of all the programs that we have. You can go directly and speak to a rep onto our chat, which is actually kind of easy. Just log on and it's going to pop up onto your right-hand side if you want to, if you wish to speak to one of our reps. And I would say from beautiful Rosarito Beach, my hometown. Very proud to say that it's my hometown. Thank you very much, guys. I hope you enjoyed this webinar. If you guys have any questions at all, just be obviously going onto our Facebook page or even onto our email, which is in this case follow-up@sanoviv.com, and we can answer any of your questions that you probably would have or any of your doubts. Thank you very much, guys. This is Oscar Puig again. Have a beautiful afternoon, guys.